Hello everyone. In this video we talk about home ventilation and disease in which home ventilation devices are used. Oxygen intake is essential for the continuity of life. Vital functions cannot occur without oxygen. Any situation where sufficient oxygen cannot be taken into the body results in respiratory failure. In the absence of oxygen for more than a few minutes, the oxygen levels in the blood drops and this called is hypoxia. As a result of hypoxia, damage to critical organs occurs and life ends. Advancing in medical science has enabled many critical ill children who were followed in neonatal and pediatric intensive care units and lost in the past to survive now. Likewise, many adult patients who were lost in the previous years are kept alive and they continue their lives depending on respiratory devices. With the parallel innovation in the ventilator technology used at home, there has been great development in adults and children in last 20 and 10 years. And patients who have been followed in intensive care units for a long time have been sent home. With the parallel innovations in ventilator technology used at home, there has been great development in adults in the last 20 years and in children in the last 10 years. And patients who have been followed in intensive care units for a long time have been sent home to their families right now. The concept of mini-intensive care environment monitored with various technological devices in the home environment has emerged. The definition of technology-dependent patient is a relatively new definition which was defined after 2000s. In academic literature, the patients who are followed up at home in a mini-intensive care environment are called technology-dependent patients, and the applications made at home are called home ventilation applications. The number of sick children and adults receiving home care is increasing day by day, and this increase will continue exponentially. Moreover, after COVID-19 pandemic, an important group of patients, especially the elderly patients, those with comorbidities, have been heavily affected by this epidemic and continue their lives depending on device. There is an increasing number of studies on home ventilation in the world. There are a lot of new studies in last years is increasing about this topic. Studies conducted in developed countries show that the number of technology-dependent patients at home has been increasing over the years. The number of patients who are kept alive with advanced medical practice and become connected to devices increasing exponentially. Especially in adult patients depend on technology devices are added to society with increasing rate every year. In children, an exponential increasing rate of patients are discharged from hospital as technology dependent. The frequency is rising, which was beginning of the 2000s, 0.1 per 100,000 patients, and when we came to 2010s, reached 2.5. Maybe today, this number is very high. A significant portion of these patients are the neuromuscular disease group, for example, in children, SMA, in adults, ALS, muscular dystrophies, ATC, lung parenchymal disease, central hypoventilation syndrome, and chest wall disease. What is home ventilation? The main problem, regardless of the underlying disease in such patients, is chronic respiratory failure. In other words, these patients have to receive continuous and appropriate respiratory oxygen support through various devices in order to continue their vital functions. The general name of device that provide the breathing oxygen support is mechanical ventilator. The type of breathing done through this device is called mechanical ventilation. These devices that transmit the air containing a certain concentration of oxygen to the airway at a certain volume and a pressure suitable for the age and lung capacity of the patient are called mechanical ventilators. There are many different and complex types of ventilators in intensive care units, and these devices have very different and complex ventilation modes. However, ventilators that perform home ventilation are relatively simpler and easier to use devices. Yet, these devices are not sufficient to be used alone, but a part of a home life support kits include home ventilator and sets, oxygen cylinder, aspirator device, tracheostomy cannula, generator and power supply, oxygen concentrator, humidifier, pulse oximeter, and balloon and face mask. What is respiration? Respiration is a complex process and many organs, tissues, and cells are involved in this process. For a normal respiration, brain, spinal bulb, spinal cord, lungs, bones and muscles in the rib cage, and large respiratory muscle called diaphragm should all be functioning properly. In other words, some cells that need to work properly during this process, especially neurons, nervous system cells, muscle cells, lung parenchyma cells, and neuromuscular junction cells must be work properly. Therefore, if all disease affecting these organs and cells become chronic and their treatment is insufficient, the result will be respiratory insufficiency. The group of disease that make up the largest group of these patients are neuromuscular disease, because while most of the other cells have a self-renewal event called regeneration, unfortunately, neurons cannot regenerate when they are damaged. Therefore, patients with neurological and neuromuscular disease are discharged from intensive care units as dependent on technology device. The most typical example of this group patients is in children SMA and adults ALS. Many diseases are resulting is respiratory insufficiency and which home ventilation is applied. For example, in central hypoventilation syndrome is inadequate respiratory control of brain. Respiratory muscle cell weakness and neuromuscular diseases is a large group of these patients, SMA, ALS, muscular dystrophies, diaphragmatic paralysis, and cerebral palsy. And another group is spinal cord injury, Guillain-Barré syndrome, transverse myelitis. And a large group is pulmonary diseases. For example, bronchopulmonary dysplasia, cystic fibrosis, congenital anomalies of lung on chest wall, severe bronchiectasis after severe thoracolplasty, before and after lung transplant. And the big group in especially small child's metabolic disease, for example, Zellweger syndrome, mitochondrial myopathies, like that. Another group of disease is a large group, some genetic and congenital disease and syndromes, some brain and spinal cord tumors, condition related to premature and perinatal trauma, especially with any reasons after prolonged resuscitation, severe brain damage after drowning or falling from a height, and after severe neurodegenerative disease in adults, especially ALS. These are very new studies about this situation. In 2019 is a large Korean study, a very comprehensive study. In this study showed that as the years go by, the number of home ventilation patients increasing exponentially. For example, 2016, 12 or 13 points became in 2018. After 2 years, it's 30. Today, we don't know. Another result of this study, neuromuscular disease, which make up the majority of patients present in infancy and early childhood. The majority of patients are young, infants, and children. Another study from Korea again, it's 13 years follow-up. The same results. The most of the patients are in SMA patient group. Includes other childhood neuromuscular and metabolic enzyme disease. This is a big study from Canada with 30 years follow-up, and the results are similar to the before studies. And let's sum up the disease. The main disease related to brain and spinal cord is central hypoventilation syndrome, cerebral palsy, patients paralyzed after stroke, group of patients who develop brain damage after meningitis or encephalitis. What is SMA? Spinal muscular atrophy is an autosomal recessive neuromuscular disease characterized by degeneration of motor nerves and loss of muscle strength. Due to degeneration seen in the anterior and horn cells of the spinal cord, protein production necessary for the function of the nerves that control the muscles cannot be pursued. As a result, weakness and wasting atrophy in voluntary muscles are observed, especially respiratory muscles. Lower motor neurons in the spinal cord, important cells in the motor function of the central nervous system, CNS. Inability of nerve cells to function causes weakness and often fatal muscular weakness. In children with SMA, degeneration of motor neurons in the spinal cord causes atrophy of skeletal muscles and weakness, often involving the extremities. The bulbar muscles and respiratory muscles are variably affected. Especially type 1 group patients need tracheostomy and mechanical ventilation in the early period of life. And the other neuromuscular disease causing damage and regression in the spinal cord and neuromuscular junction, muscular dystrophies, Duchenne muscular dystrophy, congenital myopathies, Becker muscular dystrophy, etc. Amyotrophic lateral sclerosis, which is seen in adults and has a progressive feature. Lung-originated disease, especially in adults, chronic obstructive pulmonary disease, cystic fibrosis, idiopathic bronchiectasis, congenital anomalies of lung and chest wall, for example, Poland syndrome, after severe thoracolplasty, before and after lung transplant.